Thank you for staying with Daybreak. We're still taking a stock take of what's happening around you and in all the counties, including census, but now we're talking about something different. Health services in Kisumu have remained paralyzed for the 4th day now as health workers maintain their stance on no work until their salaries are paid. Exactly, and the 2,000 workers drawn from 4 unions accused the county government of duping them after the promise to remit their July paid salary, which clearly did not bear any fruit. This is coming even as the country, or rather even as senators really continue to sort of figure out the way forward with the division row. Right now we are being joined by our very own Laura Otieno. She's joining us from Kisumu. Laura, it's good to speak to you this morning. 4 days, no medical services. How is it looking like on the ground?
Well, indeed, Zinzi, the situation is indeed dire because all public hospitals and all public health facilities across Kisumu County have not been operating, as you have rightly put it, for the past 4 days after health workers downed their tools, citing duping by the county government. Remember that the health workers were in a joint strike with the county workers, the strike that had ensued after their July salaries were not paid following that standoff, according to the explanation issued by the county government, the standoff on revenue allocation between the National Assembly and the Senate. But then on Monday, we saw the other workers resume work, and on Tuesday, now the health workers decided that they will not be resuming duty until they're paid. They were saying that none of them has had their July salaries reflecting in their accounts, and some of them, part of the health workers, were saying that there are some that have not been paid for the past 3 months, so they are sort of asking for salaries dating back 3 months, some from July and things like that. And as indeed you have rightly put it, there have been services that have been grounded. Right now where we are is at the Kisumu County Hospital, which is usually a hive of activities by this time because it has all health facilities, including the mother-child clinic. And most of the time we could see mothers with their children streaming into this particular facility to get vaccination. But then we have been monitoring for the past 4 days, and there have been no operations whatsoever going on in this particular facility. There have been people who have been forced to reschedule their surgeries. Others have been forced to seek services in private hospitals, all in fashion or all in light of that strike by the county health workers. So of course today they're supposed to be converging at the county offices to try and petition to see whether the county government will be remitting their salaries, and that we will be following up on and bringing you up to speed with details as they unfold in this part of the country, Zinzi.
All right, thank you so much, Laura.
But I'd like to find out, Laura, is there any sort of intervention that's happening right now? Any sort of mediation to stop this?
So far, Trevor, there's nothing because the county government has remained quiet over the same issue, and the workers, or rather the health workers, which include nurses, doctors, clinical officers and lab technicians, have insisted that they are not receiving any sort of white smoke from the county government. They have not been invited into a table to sort of try and clear the standoff. So there's no intervention whatsoever, and as indeed this being one of the counties that is piloting UHC, it's residents that are really suffering because most of them are saying that they require for that standoff to be resolved so that they can access healthcare, Trevor.
Thanks, Laura. That's Laura speaking to us live from Kisumu, where there seems to be a paralysis of affairs there.
Medical services.
Yeah,
4 days.
And there's no intervention, like she says.
There you go.
All right.